Awesome. All right. Well, we're back for another podcast. Mike, this is Tracy. We are the husband and wife couple building a licensed psilocybin service center business named Meadow. And this podcast is going to be about things you're learning in medication tapering, which is a fascinating concept.
Things that I'm learning.
Yeah. So, yeah, maybe take it with what's top of mind for you.
Well, I have done a lot of my own reading here and there from other psychiatrists or physicians and a lot from patients about what it is like to go through the tapering or deprescribing off of whether it's antidepressants or anxiolytics or medications for anxiety, just broadly psychiatric medications. And I recently bought the Maudsley Deprescribing textbook. So this is the first textbook I've bought since residency. And it has affirmed a lot of what I've already read. Like, okay, I have a pretty good grasp on this material, but there's still always gaps in knowledge. And so it's been really cool to fill in a lot of those gaps, especially from just the source, which is a leading psychiatrist who are leading this movement, namely a physician named Mark Horowitz. And this is a movement that seems to be, from what I'm gathering, like a focal or like a central sort of beacon point is in the UK. So a lot of UK psychiatrists are educating about this. And I suspect that part of that is because they have the national healthcare system. They have a single payer system. And so there's a bit more of an aligned incentive collectively to address the problem of these medications, which is that for a large proportion of the population, they are not effective, or they are both not effective and come with serious side effects that make coming off of them even more imperative, but also because of all of the nuance around relapse versus withdrawal versus questions about like development of a new condition, make it such that there's just a dearth of educated clinical providers, and yeah, it's just developing as we speak.
Yeah. So is it the dearth of coming off medications entirely? Like there's no research or books or experts on it?
There's very little rigorous clinical studies on deprescribing. And so much of the evidence is empirical, or basically just what people have tried.
Yeah. Wow, that's fascinating. And I'm surprised that these government organizations like the FDA or the equivalent in the UK don't make these companies do this work. Like it seems like if you're gonna give someone a drug and get it cleared by FDA, you'd have to also have a pathway to get people off, right? Otherwise, it just seems. What do you think the assumption was, that there'll just be no problem with people coming off?
I think that there was concern about withdrawal effects even when these drugs were initially being studied and going through the either the FDA or the UK equivalent process, but it was majorly downplayed. And they even came up with, I'm blanking on the term, but like rather than calling it withdrawal syndromes, which implies physiological dependency, which would have been flagged as a much higher concern, drug companies came up with a different term for it to downplay those effects. And so it was something that was not really, you would hope that our governing bodies, whose jobs the regulatory agencies are to protect the public, would have been more rigorous in understanding this before these meds get, just like blanketly thrown at the population. But when you consider the financial incentives and motives, and then also the fact that a lot of these regulatory agencies in the government are basically a revolving door between executives at the drug companies and then and then government officials. They're essentially the same group of people.
Yeah.
You start to see that the incentives aren't exactly, there's a lot of conflict of interest there.
Yeah, for sure. And it's a sticky problem because you want people who are knowledgeable about the industry to come in and govern wisely, but then you also have the clash of incentives where they could get incentivized to make policies that benefit the company that they then go back and get a bonus for. So yeah, it's a difficult one that is often critiqued. What, if any, people or research has been done on psychedelics, and why would psychedelics in particular, do you think, even have a possibility of helping in this process of tapering off, getting people off these meds?
I mean, it's a very promising avenue for helping to support people who are coming off of these medications, because psychedelics function like a nervous system reset, or like a brain reset. And so when you've gone and altered your brain chemistry, and really it's not just your brain chemistry, it's the chemistry, it affects your entire body and your endocrine systems and your gut health. And these drugs affect every organ system in the body. It can help to just support in almost like an adaptogenic way, help bring the body back into balance again in a way that may have just taken a lot longer and a lot more painfully on your own. And so I think that where psychedelics can play a role in particular is I'm really interested in the application of microdosing as a bridge therapy. So as you're coming off of the psychiatric medication, oftentimes because of the way neuroreceptor physiology is, the drug effects are highest at the lowest incremental doses, if that makes sense. And so as you're coming off of the drug, the hardest, oftentimes what's reported by patients is that the most difficult time can be, not for everyone, but can be in those last few incremental dose decreases and then the final dose, coming off of it. And I do believe there are nocebo effects at play as well. And so nocebo effects being, if placebo is you get positive benefit when you think you're taking something that will give you positive benefit, nocebo effects are your belief that you'll experience something negative actually leads you to experience a negative effect. So if you believe I have to take this medication in order to feel a certain way, or feel emotionally stable or not anxious, or like I can just function, well, then that belief, when you stop taking the medication, it can become self-fulfilling prophecy, right? Our minds are powerful that way. So I think that microdosing can be used as a bridge therapy, meaning you introduce the microdose before, when you're in those lowest doses, incremental doses in the taper, continue the microdose when you stop the psychiatric medication, and then coming off of the microdose at some point afterwards, when you've already come off of the psychiatric medication, is a much softer landing than you would have had otherwise. There's no scientific research on microdosing as a bridge therapy. This is something that would be off-label and something that I have had success with when working with other clients who just wanted to try this on their own, and I just helped provide guidance on how to microdose properly. There is literature on microdosing itself. It's just like whether or not to use it as a bridge therapy. It's perfectly safe physiologically to do it, which is really nice as well. And then once you've reached a new baseline of, your nervous system, like the adaptation that happens going on the medication has been reversed, and you get to a new baseline level for a couple of months, well, then you've resensitized your system, because a lot of these medications have blunting or diminishing effects for psychedelics. Once you get the medication out of your system for a few months, and you've reached a new baseline, then it can be really interesting to start doing the deeper root level work with macrodose journeys, and to really get that so-called factory reset. And that wouldn't be available to you before when you're on the psychiatric medications, but to actually go through that process after you've tapered off. Mm-hmm. So we've had quite a few people come our way who are interested in experimenting in this way. it is an experiment, a self-experiment, and theoretically it all checks out, and then it's just a matter of experimenting with yourself, and that's sort of where the art of medicine comes into play. But I've seen people have success with this, and actually being able to attain a level of well-being off of psychiatric medications and without side effects, and get to experience the healing power of psychedelics, psilocybin in particular, and I think that this is going to become the future of how we approach mental health.
Yeah, I often wonder if I guess there's just multiple perspectives on this. One is that it's a recipe. We're making a soup, and you have to have the right chemistry that interacts with the neurons in a particular way to get the output you want, which is less pain, really, on the way out of these medications. And then the other is what you experience firsthand when you do psilocybin or psychedelic, is that it's not just changing you on a physiological level. It's an incredibly powerful experience, which is unlike many at least medications we take, that you take them and you might not even know you take them, and it helps with your allergies or whatever. But psychedelics are not that. It seems that their primary healing power is in the experience of me as a young boy who was very shy, and I never was able to grow spiritually or emotionally in this particular area of my psyche, and it kind of guides me in that direction. And it's very mysterious exactly how that works, because it doesn't seem like it maps onto the brain at all, or at least very clearly in any way that people have made any theory about how that works. And so I almost look at these things as the psych meds certainly has, I think, the perspective of it's a body, we got to fine tune it. People use analogies like we have to rewire, or you were born with a chemical imbalance, or and regardless of what the root causes are, which are interesting in themselves, most likely psychological, that why people go on these things in the first place. I doubt many people, a very small percentage, are born with a neurological disorder that requires them to have these drugs to function properly. But given that they kind of operate, or at least I see them as these different models or perspectives of like the fine tuning and then the experiential, mapping them on together is really interesting, because it's like, okay, something's wrong with your brain. We got to take this drug. You're on it for a while. It's not working or has side effects. Now we're going to introduce a small amount, microdosing of an experiential drug, right? Substance in psilocybin. And maybe I don't know, I'm curious how you react to this, but it maybe microdosing is like, it addresses your subconscious, that's why it's subperceptual, but maybe it's like someone knocking at the door really softly, or it's a really small cue to your subconscious to start the healing process, for lack of a better word, or could something be going on experientially in the microdosing of the psychedelic that then starts to chip away at the subconscious, or introduce a kind of an experiential pathway? I don't know if does that make sense, because I just try to understand these things. It's one sense to understand them like technically, and then you understand what's going on in the big picture.
Are you asking if there's any experiential component to microdosing?
I would think no is the common answer, right? It's subperceptual.
No, there definitely is. Otherwise, why would people do it if they didn't experience a change in their experience, right? If you just don't feel different, like what is experience? What is your conscious experience of reality? Feelings, sensations, thoughts, beliefs, your identities, just the psyche. Mm-hmm. Everything that you experience in life is filtered through your psyche.
Yeah, right. Everything psych med related would have to cash out for your experience. Otherwise, there's no point.
Right. So I think when it comes to microdosing, that's part of why I think microdose coaching is so important, because it is the way that psychedelics work is they are made massive, unlike conventional psychiatric medications. Psychedelics are mind manifesting, soul revealing. They work by they are powerfully your experience of the medicine of psychedelics. I don't call it medication. The medicine is that least when you're using it therapeutically, is the intention that you bring to it, the ritual that you create around it, the increased introspection, contemplation, reflection that you have when you're doing it. And so with microdosing, it's no different than with a macrodose, except, you create a ritual around taking it. You don't just pop it and move on with your day and do it mindlessly. The whole point of it is to increase self-awareness. And when you increase self-awareness, that's when you can have conscious control over your experience. Of course, control is an illusion, and you don't ultimately have 100% control. It's a co-creation with life, your experience of reality. And most of us in the default mode state of consciousness are just like flying by the seat of our pants, thinking that we're just subject to whatever happens to us, instead of having conscious input into our experience of reality. And so microdosing is a way to dip your toes in the shallows of what that's like, to approach your life intentionally, to approach your life with increased conscious awareness about what's going on in yourself. And it's just a completely different paradigm and different approach. And so with microdosing, there's a lot of hemming and hawing about what a microdose really is, and is it subperceptual? And there's a lot of misconception and misunderstanding and lack of education.
Isn't that kind of semantics in many ways?
Yeah, there's some semantics, but I think it's important still to talk about where, technically speaking, a microdose of a psychedelic should not be altering your visual field more than anything.
Yeah.
But some people will increase the dose enough so they do want slight changes in their visual field, things look a little brighter and sparklier. But there often is some subtle mood elevation or smoothing of edges. There is sometimes an increased window of tolerance for stress, increased nervous system capacity, increased awareness of one's emotions, very, very slight increased emotionality in a positive direction when you're at those really low doses. And with mushrooms, we're talking anywhere from 0.1 to 0.4 grams. 0.4 grams would probably be on the high end. Most people are going to definitely feel 0.4 grams of whole dried mushroom. And so, in theory, you should feel enough of a difference of I think more mood effects than anything, but then the visual effects, the extreme, everything else is, I think basically perceptual differences are going to be mostly limited in the realm of mood. Maybe some people feel more creative or that sort of thing. And then, once you get to the point of feeling, significantly altered enough in your visual field and that sort of thing, then you're beyond the microdose range. You're into low dose range versus medium or mesodose and then macrodose. So those are sort of the different dose range levels. And, I had a commenter, people ask my advice all the time, I can't give advice. This is just education. But he had tried microdosing and he was taking 1 gram of mushrooms a day.
Wow.
And I was like, sir, that is not a microdose. And I just said, please download my dose. We have a free dosing guide. We can link it in the description. Just educate yourself. And I'm always just a client recently was sharing anecdotes about his mushroom experiences and just with other, middle-aged men, fathers of teenagers, casually doing mushrooms and not having no idea what dose of mushrooms they're taking. Mm-hmm. And I just being quite cavalier about it. And it's different than, these are different than substances, than alcohol and even cannabis, weed, marijuana. It's a different class. You don't want to go... I'm just so surprised at how some people are quite cavalier about, taking mushrooms and not knowing what they're taking and combining it with alcohol and that sort of thing.
Not enough people like you talking about it.
I don't recommend it. It's not to say that you can't get, safe, underground illegal sources of mushrooms. Most people who are growing mushrooms are not trying to do harm in society. Mushroom growers tend to be pretty good people. But it's not any basically setting aside the sourcing issue, but just know if you are going to take it, how much you're taking. Educate yourself. And it's like a child or a teenager who wants to experiment with alcohol. You wouldn't just go and down a fifth of vodka, first time, and you would know. And I think if we had a culture of taking mushrooms, we would, this would just be well known.
Yeah.
The different amounts and that sort of thing.
Yeah, it is interesting how these things get labeled differently over time, and the substance itself might not even change, but the labeling is different, and it completely changes the usage. Like MDMA is a good example, ecstasy, right? You just, this is like a club drug you take at raves, and then it's like going through the FDA pathways for psilocybin too. I mean, although psilocybin's less of a party drug, I think historically, but having these things be reframed in the clinical or a therapeutic context is interesting and just shows how it is so much about our labeling. Are there other things that are useful for people that are interested in tapering that maybe we didn't talk about? There's microdosing psilocybin. I presume there's just as much, very little research on, let's say, LSD or other psychedelics for microdosing. I don't know if any of these psychedelics are more preferable than others based on the drug that people are on or the medication that people are on. I assume most of that is still Wild West.
Completely, yeah. I mean, the psychedelic that's shown to be the most powerful reset of neuroreceptors and neurochemistry would be ibogaine, actually. Yeah. And so I think people are also microdosing all different psychedelics, mescaline, ibogaine, all the rest. You can microdose any of them. It's just about a matter of finding some that you can. Yeah. But in theory, it would be ibogaine that would actually help the best. And so, could I imagine a world where hopefully we're studying ibogaine microdoses as a bridge therapy for helping people taper off of ineffective or harmful psychiatric medications? That would be awesome to see. But yeah, and then when you look at also just the neuroplasticity, that's commenting on the neuroplasticity that's available afterwards. So, but it may also be condition dependent that, someone who skews a little bit more anxious in their symptomatology may benefit better from one versus if someone skews a little bit more depressive in their manifestation of their issues. So it's the very beginning of this kind of science.
And I imagine it's blunted, right? The same way that if you were to do a big dose of psilocybin on SSRIs, it's going to be blunted, or the experience will be lower than if you weren't on an SSRI. So a microdose isn't the same for people, right? Is that the right way to think of it? So,
potentially, yeah. I just don't know. Yeah, it's hard to say.
Yeah. Any particular psych meds you think that are more, have you seen any that are easier to taper off of or harder, or any specific techniques other than psychedelics that can be useful?
Well, to answer your first question, the SNRIs seem to be effects seem to be a lot harder because they hit not just your serotonin but also norepinephrine. So the more neuroreceptor subgroups are affected, presumably the more adaptation changes you have, the more you're going to have withdrawal effects. So those that's been said to be harder to taper off of. Any medications that have a shorter half-life versus a longer half-life are going to be harder to taper off of. So sometimes one strategy would be to switch someone from a shorter acting SSRI to a longer acting one. And then your second question was...
Wait, just so I understand that. So that would be the half-life. So you take it and it's like slow release.
It's different than slow release. It's just how quickly the drug, how many half-lives it takes, how long the half-life is until the drug is eliminated.
Got it. Yeah. And it's easier to come off of the long half-life than the short. And that's because, why?
Because of the pharmacokinetics of the drug. So basically when a drug more quickly eliminated, you're going to have a higher peak and a higher drop off versus a drug that has a longer half-life.
Yeah. It's interesting. So the other thing I was curious if you've seen any, some people online that.
No, there's a second part of your question.
Yeah, it was about other things that are useful for people, whether it's like cold plunges.
And the tapering process. Well, people, if you're not going to do psychedelics, like people who are tapering off of these medications are just doing it all different ways. People do it just cold turkey, not recommended, but there are reports of people who don't have any withdrawal effects. And so they'll just cut off, or they'll have a month of terrible withdrawal effects and then that's it. So it's like ripping the Band-Aid off. Other people will taper off of the convention right now is, as little as 4 to 6 weeks. And it's just not enough time for a large swath of people. There's a large swath of people who really do best with something called hyperbolic tapering. So that's where you're, instead of linearly decreasing the dose, you're exponentially, in an exponential way, decreasing. So you're decreasing the dose by, say, 10% each time and just going very slowly. And some people need, depending on their physiology, like up to a year. Or I don't know, maybe even more with going super slow. I'm following this story. I think he's called Cold Plunge Cam on Instagram. This guy is super inspiring. He was put on an SSRI when he was only 9 years old. And he is, I don't know exactly how old he is now. He's either in his maybe late 20s, early 30s. And he has decided to come off of it. And he's going super slow. Like he gets it compounded in a liquid form, and he's just, anytime he runs into issues with his mental health, he'll back off and just stay on a dose for longer. He's just going very slow. And to speak to the other modalities you're asking about, he's been doing cold plunging as part of his main modality for helping him regulate his nervous system as he comes off of the drug.
Yeah, it's awesome. It's a cool story.
It's really awesome that he's documenting it and sharing it. And I really enjoy watching him in his expression with all of it and just following the story too. I just think it's a fascinating story just from a patient perspective, just living it. So I feel like that's who teaches us the most about deprescribing, people just going through it.
Yeah.
And for anybody who's thinking about taking this on for themselves, I mean, huge core philosophy within the psychedelic world is your mess becomes your medicine. It's such a valuable thing to, if you decide to take this on, this challenge, to really view it as the medicine, the wisdom that you will eventually share with the rest of the world for other people who want to go through the same thing. And so I really encourage everybody to just journal through it, share. I mean, it can be really vulnerable. You don't have to share actively while you're going through it, but trust that it could be the thing, your next calling, your next purpose is helping other people go through the very thing that you just went through. You're going to be the best person possible to support other people going through something like that. And there's such a huge need, just because there's most providers, A, don't have education about this, and B, don't believe that their patients can do it. And so and that's what you need more than anything is the belief that you can do it.
Yeah. I know we're incubating a lot of this stuff and we're leaning into this more and more as we work on this. Is there anything that you'd want to invite people to do? They could reach out to you to talk to you about coaching for tapering. We've talked about different ideas as how we build either a community or products or services to help people with this. Obviously, people feel free to reach out to us, but anything you want to add as to what we're thinking about or creating or offering for people that are looking for some help?
Well, of course, we invite anybody to just, submit an application, have a free consultation with us. No matter where you are in your process, we're more than happy just to have a conversation with you and see where you're at and what you've tried, what's worked, what hasn't worked, what your hopes, dreams, fears, all of it are in this kind of work. And I'm just learning too, and just responding to what people are sharing with me and with clients, and And so, yeah, whether it's like just a written tapering guide or videos or we've talked about creating like a school community with resources. I don't know exactly what it looks like. I imagine that it's going to just continue to organically evolve with the clients that we're currently working with who inspire new, we already have a preparation masterclass. We just give that to all of our clients, and I want to just give it out for free. We have like written preparation materials, like we have the dosing guideline, like all of these have been created just very organically in response to a need that we had. So I think if people want to leave comments, like that can inspire stuff and help us with learning. But then of course people can reach out as well. Those are probably the best ways.
Yeah. I'll put some links in the show notes. And that's about a wrap for today. I know we have to cut it. Thanks for diving in, and look forward to more of these conversations.
Me too.
Bye.